Swadikap. Good afternoon once again. Tuesday, the 4th of May, 2021. I'll start off first with the information about the number of cases that we have recorded for today. So we have 1,763 cases recorded for today. Out of that number, 1,519 are from local transmission, 231 from active case finding, and 13 cases from within the state quarantine system. We have new recoveries, quite a good looking number for new recoveries recorded for today, which is 1,490 persons. So as compared to 1,763 new confirmed cases. So active cases in Thailand now stands at 30,000. We just passed the 30,000 mark. 30,011, as you see on screen in the green box. And out of this number, 1,009 are considered cases in critical condition, and 311 are cases on ventilators. So for the fatalities for today, unfortunately, we have still a high number of fatalities comparatively to the past days and weeks and months in the past. So we have 27 new fatalities recorded for today. Cumulative is now 303 fatalities. In the 27 fatalities, we have 21 male, 6 female, age range 25 to 92, and median age is at 66. In terms of the area of location distribution for fatalities, we have 8 from Bangkok, 5 from Nonthaburi, 2 each from Lamphun and Samut Prakan, and 1 each from a number of other provinces. Now, 9 of these fatalities were in close contacts with infected family members. Another 9 were in close contact with confirmed cases at restaurants and at a wedding ceremony, actually. And the others are from visits to crowded areas. There were 2 fatalities which were in close contact with co-workers from their office, and 1 was a staff at an entertainment venue who visited risk areas. Now, overall, for Thailand, we have climbed up actually the ranking, which is the more you climb up, it's actually not good news. So we were at 100 and plus, 120, whatever in the past weeks and months. Now, we have climbed up to 99th. We're in the 99th place in the world now for COVID infections. In terms of the provincial statistics that we have, and yes, on screen we have that for you. You can look at the detail of the provinces with the highest number of new confirmed cases as recorded for today, to date. So Bangkok, 562. Followed by Samut Prakan 201, and the other provinces you can see on screen. To date now, all 77 provinces in Thailand have been found with infections. However, for provincial rates of infections, it was found to be somewhat of a stable number, sort of like able to be controlled to some point, because the numbers have been quite stable in the various provinces. For Bangkok in particular is actually the hotspot for today, for these few days. In Bangkok and adjacent provinces, in this matter, we saw a total of 956 infections. So in various districts in Bangkok, we have some reports from Pathumwan district and from Dusit district as well. The other day we talked about Klong Toei, wherein the active case finding our missions are being continued. Now for Pathumwan, there's a report in Bon Kai area in Pathumwan, confirmed cases 162, and more active case findings will be performed in this particular area in Bangkok. Also in Mahanak intersection in Dusit district in Bangkok, there were 80 confirmed cases, mostly found in crowded communities in the area. And the number of infections had peaked after the Songkran holidays. So we have two areas that are kind of hot potatoes now in Pathumwan and Dusit district in Bangkok, aside from Klong Tei. So in general, there will be more active case finding missions to conduct to search out for those infected, to get medical treatment as soon as possible, as well as those who are in risk groups as observed by the authorities, for they can be quarantined, be observed, and get tested to control the spread of the virus. And basically, more critical condition cases and fatalities arose after the Songkran period. So hoping for the best in Bangkok. Now, Dr. Thuisin just now also talked about the medicines supplies for COVID treatment. So now, as the number of confirmed cases in general in the country is steadily rising, we're putting our best foot forward in the fight to curb the spread and doing our utmost for the treatment of all infected persons. In terms of the Bangkok Metropolitan Administration, we have set up the 5th Field Hospital in Chalerm Prakyet Sports Training Center in Thung Kru District to accommodate 400 patients. The BMA has also planned to conduct more active case findings in Bangkok to slow down the spread of the coronavirus, and where it is aimed to test up to 7,200 people this week in particular. Now, I mentioned about medicine supplies just now, and Dr. Thuisin mentioned this, that the Food and Drug Administration had ensured that Thailand will have enough medicine to treat COVID. So with Favipiravir remaining at over 1.6 million capsules in stock, 1.6 in stock right now, the FDA has ordered an extra 2 million capsules from Japan, which is set to arrive within this month. This is Favipiravir. So now, as only about 85 vials of Remdesivir are in stock, the FDA has procured another 3,900 vials, which have already arrived yesterday on the 3rd of May. And another batch of 6,900 vials are set to arrive tomorrow or the 5th of May. So this is about the stock of the various medicines needed by the FDA for treatment of COVID in Thailand. So just to repeat once again what I mentioned a few briefings ago about the guidelines for domestic flights. Now, the Civil Aviation Authority of Thailand issued new guidelines, as I mentioned before, on control measures for all domestic flights. This is following the infections in recent flights to and from Phuket Airport. This includes the limiting of number of services and flights between 11 p.m. and 4 a.m. And both passengers and visitors will have to get their temperature checked upon entry and exit. And officials are responsible for alerting authorities about those who have high temperatures. And airlines will ensure social distancing and inform passengers not to travel if they have been infected or have come in close contact with confirmed cases. Now, I repeat this and I recap this because, of course, many of you may be in the position that you would have to be traveling to the different provinces for personal or for work. Of course, travel is discouraged, but if you have to, please take note of the information I provided just now. So this morning we had the daily CCSA meeting, as always. It's a coronation day today. It's actually a holiday. But today we discussed a lot about the management of the supply of beds in terms of the field hospitals and the system. So for further improvement as we go along, as we fight COVID. So that was discussed in detail this morning. So just to recap on some useful information, additional information from the World Health Organization. Towards the end of the briefing, I often bring out these infographics. Some of you might be wondering about self-quarantine, proper self-quarantine, especially if you have been in close contact with confirmed cases. So the infographic here informs you of the basics. You can read that on screen. What you need to do when you isolate yourself at home in terms of having a ventilated room, hygiene in terms of facilities, laboratories. If you cannot find a single room to quarantine yourself before, be sure that you always stay 1 meter apart from people within the house. Now, it's advised as well to also wear masks within the house especially if you have the elderly people with you. This is very important, and make sure that you're comfortable as well when you're isolating yourself, because isolating yourself is tough enough. And make sure that you always have a positive attitude and relax. So once again, just remember that when you're taking care of yourself and doing your part to prevent the further spread of COVID, you're not just doing this for yourself. You're helping to protect others as well. The responsibility to curb the disease depends on you as well, depends on all of us. So please have a pleasant rest of the day. This is the short recap that I have on a daily basis. And when there are important information that we have confirmed, I'll inform you as soon as possible for your benefit, and then for all of us to continue to fight against COVID together, hoping that we will be having lower numbers in due course because of the new active case findings, especially in Bangkok. In Bangkok, as I mentioned, now more or less the excuse me, the hotspot now in Thailand right now. But rest assured that the active case finding, it's being done. It will be done in many districts in Bangkok to root out those who are positive, and hoping that we will not see higher numbers than the mid-thousands that we have today. Today it's 1,700. The other day was 1,005, 1,004. Some days, once in a while, these days we have around 2,000 cases. But comparatively to other countries, we're not that high compared to other countries. But as we always say, we should not compare ourselves to others, but we compare ourselves to ourselves and see that tomorrow will be a better day for all of us. Thank you for your attention. สวัสดีครับ